having the person perform certain movements. You should see hip flexion of 90 degrees with a straight knee.
Good. Keeping this leg straight, I'd like you to bend the other leg into your chest.
Hip flexion of 120 degrees with a flexed knee.
Good. Now I'd like to have you bend your right knee, put your foot right on the table.
Internal rotation of 40 degrees.
Towards me. And now to the opposite side as well.
External rotation of 45 degrees.
We're going to lift your left leg, take it out to the side as far as it's going.
Abduction of 40 to 45 degrees.
Across your body.
And adduction of 20 to 30 degrees.
Good. And you can relax. Good.
To examine the knees, begin with inspection. The skin normally looks smooth, even-colored, and free of lesions. Assess lower leg alignment. The lower leg should extend in the same axis as the thigh. Observe the knee's shape and contour. You should see concavities on each side of the patella and should find no fullness or swelling. Check the quadriceps muscle for atrophy, which should not be present. With the quadriceps relaxed, palpate the knee, starting about 10 centimeters above the patella. Using your thumb and fingers, palpate down toward the knee, exploring the suprapatellar pouch. The muscles and soft tissues should feel solid, and the joint should feel smooth with no warmth, tenderness, thickening, or nodularity.
I'm going to check your knee for fluid now. You're going to feel me touch the inside of your kneecap.
If you notice swelling, test for the bulge sign. To do this, firmly stroke up on the medial aspect of the knee 2 or 3 times. Then tap the lateral aspect. Watch the hollow in the medial side for a bulge from the fluid wave. Normally, none is present. Now continue by palpating the tibiofemoral joint, which should have smooth margins and no pain. Also palpate the infrapatellar fat pad and the patella. Check for crepitus by holding your hand on the patella as the person extends and flexes his knee. Some crepitus is common.
Straighten. Good.
Next, check knee range of motion by having the person stand and perform 2 movements.
You can stand here and hold on to
You should see flexion of 130 to 150 degrees and extension of 0 to 15 degrees.
Good. Now, without holding on to the table, I'd like you to squat down to the floor and
To
stand
test
back
muscle
up.
strength, have the person rise from a squat or from a low chair. He should be able to rise without using his hands for support. Then, with the person seated, ask him to maintain knee flexion while you try to pull his leg forward.
Very good. Now I'm going to examine your feet.
Inspect the person's ankles and feet while he's in a non-weight-bearing position. Compare both feet, noting the position of feet and toes, joint contours, and skin characteristics.